Personally, I soak my saffron in Zhao Liang liquor. Gin has a particular scent which smells great but doesn't taste so good. There are high levels of juniper oil in gin. It's very fragrant. I have only encountered one person who loves the taste of gin. It's a matter of personal preference. It's fat-soluble. Saffron has flavonoids and other compounds. After you soak the saffron in liquor or water, eat the herbs too. Yes, the smell of gin is strong. It smells nice. It smells good. Pine smell, like pine sol. It doesn't taste good though. It's also not expensive. It's around $30 US. It's 1.75 liters with 20 grams of saffron. So you need to use 10 grams for every 1 liter. Okay, let's start with the class. During breaks, you can drink a bit of the saffron gin or ask me questions. Now, when you understand TCM physiology, then everything becomes clearer. When you have deficiency, in other words, your organ and bodily functions are not optimal. You don't even have enough enzymes or white blood cells in your saliva. This deficiency causes the digestive systems to be weak as well. During this time, if you are attacked by exterior pathogens, diseases not only enter through the skin, but also through the mouth. Once the pathogen is inside the body, is your body able to expel it? The herbs can only do so much if your Zheng Qi is so weak that you can't expel the pathogen yourself. If your digestive system is impaired, does it help that I give you the best herbs? No. I have quite a few cancer patients now. One of them wants me to hurry up and tonify her mother's body so she can undergo conventional treatments of chemo and radiation. An important part of what I do is to restore the digestive system. When you can properly digest and absorb nutrients as well as expel toxins, your body can slowly heal. This particular patient was so eager for me to give her mother anti-cancer herbs. I told her that her mother could not withstand the harsh effect of anti-cancerous herbs since she only has one semi-functioning kidney left. I believe it will do her more harm than good because her body can't handle it. Symptoms should be addressed first when dealing with acute conditions, while the root cause can be dealt with later. But in cases like this, you have to treat both at the same time. You always have to evaluate what is more important to address first. If symptoms are new, like a common cold, then treat that first. Next, address the root by strengthening the body. In this case here, you can either choose to expel the exterior first or strengthen the Zheng Qi. If you are dealing with someone with sinus allergies, urticaria, or an allergic constitution, should you treat the manifestation, or would you treat the root? You need to think about it carefully. If you are simply trying to expel the exterior, you need to be careful in deficient patients. Why? Because you may oversweat the patient and cause more deficiency. That's why Zhang Zongjing wrote in his book to eat porridge after taking Si Wu Tang. Can the porridge be oily? No. How about porridge with meat or seafood? According to Zhang Zongjing, no. Why? If it has ingredients like pepper, 1,000-year-old egg, and other spices that may complicate the matter. Zhang Zongjing only instructed to eat white rice porridge. When the body is deficient, it cannot tolerate the strong diaphoretic effects of the herbs. It may cause the patient to have excessive perspiration leading to more deficiency. When the exterior pathogen is mild, you can simply just tonify the body. One thing to watch out for is that tonics will cause the exterior pathogen to move inward, especially Huang Qi. It will cause the pathogen to be trapped in the body, much like the mucus that is still present in the body because it has not been expelled. What happens to all that mucus? Do you know? Your body cannot tolerate it. When you tonify, you must do it properly. In simple cases of yin deficiency, I usually use Bai He Zhu Jin Tang. In yang deficient patients, I usually don't treat the respiratory system. I usually treat the digestive system instead, and the reason is because lung is usually yin deficient and not yang deficient. Yang of the lung is dependent on yang of the stomach and spleen. Qi deficiency, I like to use Buffay Tang. For blood deficiency, Biaozu Lu He Tang, which is the variation of Si Wu Tang. You may be surprised that Si Wu Tang can be used to treat common cold. Yes, it can when your diagnosis is blood deficiency. Our health system in Taiwan is very strange. I hear it's bad in the U.S. as well. Sometimes insurance will deny a patient because the herbal prescription is not normally used for the condition submitted. When that happens, I attach a copy of my differential diagnosis and herbal formula book for them. I question the evaluating doctor from the insurance company on his ability to diagnose. In TCM, he should know the concept that a same formula can treat various different disorders, and various different disorders can be treated with the same formula. Now, I ask my insurance billing person to review my cases before they're submitted. I remember my staff asked me why I used Wu Ling San Liu Wei Di Huang Wan for an allergic rhinitis case. It doesn't make any sense since no book has documented any use of these formulas for allergic rhinitis cases. My insurance agent said that's out of the norm and I wouldn't be reimbursed for the claim. So I insisted my staff submit the claim. If the evaluating doctor from the insurance company denies my claim, I will write a long letter citing various sources on how to diagnose and prescribe properly. I will even encourage him or her to study more. How can Liu Wei Di Huang Wan not treat allergic rhinitis? Long Dan Zi Gan Tang can too. Don't assume only certain formulas can treat certain conditions. Today's diseases are more complicated. How about yin deficiency? The most suitable formula is Bai He Zhu Jin Tang. It has Dang Gui. What else? Shu Di Huang Bai Shao. What is the basis of this formula? Who says Si Wu Tang can't treat common cold? Bai He Zhu Jin Tang is based on this. So the difference is just some yin tonics. One of its functions is to nourish the kidneys. Also, it moistens the lungs. What's the main indication? If there is yin deficiency, what happens to the phlegm or sputum? It will be more and more sticky and hard to expectorate. That's why yin tonics need to be used to moisten the lungs. Then, phlegm can be dissolved and expectorated. The reaction after serving formulas like this or Long Jiao San is that profuse sputum will be expectorated. What about Western medicine? What do they have? Cough drops. There's a specific brand that I can't remember what it's called in English. What happens to the phlegm after you take Western medicines? Western meds do not help you expectorate the phlegm, but herbs can. Which herbs can do that? Zhizhen Bimu. Because of yin deficiency, patients will have dry throat, 5-heart heat, bone steaming sensation in severe cases. Do you think these patients sleep well at night? These yin-deficient patients will cough mostly at night. This formula can be used for tuberculosis, chronic bronchitis. Once I had a dinner gathering with my colleagues. One of them sighed and said he couldn't treat this one patient. I was very impressed with my friend since he had been treating this patient for 1 year for his cough and he was still unwell, but kept coming nevertheless. He is that good with the business aspect of running a practice. He said that he used all sorts of formulas and the patient would flip back and forth between getting better on some days, but worse on others. He is so good. I can't believe the patient hadn't left. So he was sitting next to me and kept asking me. I was a little drunk, so I shared my treatment secret with him. I asked how old the patient was. He said the patient was in his 70s. I asked him if he asked the patient if besides the cough, he also experienced back soreness or urinary leakage. He said that the patient complained of back soreness, but he wasn't sure of that, and urinary leakage occurred during his coughing spells. He did mention that when he coughed, he would also experience stomach pain and would curl up like this. So I asked if he knew a modified formula of Liu Wei Di Huang Wan called Du Qi Wan. Du Qi Wan is Liu Wei Di Huang Wan with Wu Wei Zi. Ba Zhang Chao Shu Wan is Liu Wei Di Huang Wan modified with what herbs? Mei Men Dong Wu Wei Zi. I told him to use Ba Zhang Chan Shao Wan. It's also called Mei Wei Di Huang Wan. I recommended this formula. In 3 days he called me and told me the patient was cured. Why? Because the kidney qi is strengthened. His kidney can grasp the qi downwards now. So, can Liu Wei Di Huang Wan treat cough? Yes, and very fast too. A month later I saw him. He said that, the patient never came back. I just kept emphasizing that he had great business skills. If a patient stayed with him for a year and still kept coming back. This friend of mine was the assistant director in his clinic the 2nd year out of school, while I am still an attending physician. So, do you know what? Don't think that certain formulas can only treat certain diseases. There is no such thing. Many times, my patients over 50 have these things in common. What? Kidney not grasping the qi down. Also, spleen and stomach coldness. So, many kids have cold in the spleen and stomach. The key priority in treating anything is to strengthen the digestive function and improve the appetite. When digestive functions are optimal, phlegm will be resolved by itself and the condition will improve. If you think about it, if the patient has poor digestive function, how can he or she digest and absorb any herbs? How can what you give be effective at all? How is it possible for anyone to heal if he or she can only absorb 20% of the herbs you give? If you don't have herbs, use moxa. Moxa is great to strengthen the body. For the case described earlier on the older gentleman, moxa would have been great. You can even add some yin tonic points if the moxa is too hot. What points? Let me tell you, it's not what you think. Think about it yourself. Bai Hui, GV20? No. Do you want me to tell you? Feng Long, ST40, and Cheng Shan, BL57. You didn't think of that, right? Lots of people don't dare to moxa Feng Long, ST40. Both these points are great to moxa to strengthen the stomach and kidney. If the cough is more severe, moxa an additional point, Zhuan Zhong, GB39. Also, Tai Zi, KI3. These 2 points push the water upwards to the throat and lungs. When you use these 2 points, the throat will no longer be dry, and the lung qi can be grasped downward by the kidney. Naturally, the body won't cough anymore. Zhuangzong GB39 is not a commonly used point, and there is a special needling technique. It's called Zhuangzong point. What channel is it on? Stomach? No, gallbladder. How do you needle it? You have to needle it from the stomach channel. When you needle this point correctly, you will feel something in the throat, and then saliva will come next. This point can be effectively used to dispel phlegm when it's stuck in the lungs. It's especially effective when one has sore throat, hoarseness of the voice, dry throat. This point can moisten the throat and restore your voice as loud as the hanging bell, which is what the pinyin translates into. That's the reason it's called Zhuangzong. If you have a chance, look into the significance of the point names. This is a great book that explains the origin of the point names, and with this understanding you will know the functions of the points without having to memorize anything. I don't remember the name of the author. It's just a thin book. But I know it's out of print already. I couldn't find it. I don't see it in the bookstores anymore. This is Zhong Tang or Zhong Wan. It has Ren Shen, Gan Jiang, Zigan Cao, Bai Zhu. It warms the middle, dispels cold, tonifies qi, strengthens the spleen. Is there anywhere in books that mentions this formula is for cough? When the spleen is strong, phlegm will resolve itself. When qi is tonified, lungs are strengthened as well. Many people wonder what herbs can be used for lung yang deficiency. There are no herbs for that. The way to strengthen lung yang is to use Zhong Tang and Bai Wan Di Huang Wan. Kidney yang deficiency can lead to lung yang deficiency. In that case, it would be better to choose Ba Wei Di Huang Wan. The older gentleman we talked about had to use Mai Men Dong and Wu Wei Zi because he had yin deficiency. What would you use if you wanted to bind as well as tonify yang? Ba Wei Di Huang Wan, of course. Would you add Wu Wei Zi? That's a yin tonic, though. There is another herb that is even better. What is it? Wu Mi. No. No. Not Dong Chong Zhao Cao. It's too expensive. 600 grams of it cost about $20,000 to $30,000 US. Come on. No more guesses? He Zi. He Zi is specifically for this. Its astringent effect is very powerful. It descends qi and relieves wheezing. You can modify formulas freely. You don't have to use an herb in the cough-relieving category for cough. Many of my colleagues like to study books written today or read the latest research, etc. Not that it's bad, but I feel that many of the books are just like shows where strange ideas are proposed. In today's informational age, where news and research are readily available online, who really knows what the truth is? There are always conflicting opinions in the healthcare industry about what's right. I have a colleague who is an excellent student. After he graduated, he went on to many TV shows. But many of his ideas expressed on TV don't make much sense. For example, he says white radish is warm in property, but that once it's cooked, it becomes cold. Again, white radish is warm when raw, but cold when cooked. It's so ridiculous that there are people like that spreading this kind of misinformation. What are you going to do with those people? I really want an explanation from people who spread misinformation. Most will probably say, it is what it is. There is no explanation. If you ask me a question in my class and I have no explanation, you can opt to leave. If I have an explanation, please listen carefully and think it over so you can completely understand my information. My initial degree was in nutrition. Then, I studied public health. When I was in public health, my professor trained us to think logically because he said anything that is taught in any class could be wrong. PBL, problem-based learning, is very popular now. My professor had a sign on the door that said, "There are no stupid questions or statements." He also said that everything that is a fact today can be wrong and debunked later. Being wrong or debunked may not be a bad thing, as long as whoever can prove you wrong has a solid logical explanation. Most people just spread misinformation without any proper explanation or proof. I want you to learn from the classics and their theories. Jia Wei Li Zhong Tang from Ren Zai Zi Zi Fang Lun is used for what? Cough due to spleen and lung deficiency cold, which is yang deficiency. One of you asked me why asthma patients have more flare-ups during winter. Cold constricts, and you need to either address the spleen and stomach or the kidneys. What formula treats lung deficiency with cold? Zhao Qing Long Tang. So you can use Jia Wei Li Zong Tang and Zhao Qing Long Tang. The only problem is that you will not see quick results. The key is to regulate the spleen and stomach, and that takes time. My main focus for most diseases is to strengthen the spleen and stomach functions. Do you remember the little girl who had to go to the hospital every week? I used Ling Zhui Zhu Gan Tang, Chen Tang, as well as a few other herbs for the lungs. I didn't use herbs only for the lungs because excessive ventilation of the lungs will induce fever. Why? Because the immune system will be enhanced, including fever, to start making the sputum even harder to expectorate. Hence, I wanted to work on the digestive system first. If there is diarrhea, then you know the sputum is being dispelled since kids swallow the sputum. Adults know how to cough out the sputum, but kids don't, so they swallow it. When you use spleen tonics, the sputum will be expelled out in the form of diarrhea. Depending on the specific symptoms, you can modify the formula by adding the following. You can even add Si Wu Tang. It's excellent to tonify and move blood. Whoever formulated Si Wu Tang was a genius. When blood is abundant and also circulating, yang qi can move freely. What did Gi Hong first use Si Wu Tang for? During what dynasty was Si Wu Tang first recorded? It's before the time of Gi Hong. It's in a text which included formulas for trauma and surgical conditions. It originally had Dang Gui, Chang Zhong, Sheng Di Huang, and Bai Xiao. It had Sheng Di Huang because for trauma. Sheng Di Huang is better to nourish and cool the blood. Later it was changed to Shu Di Huang for gynecological disorders. Shu Di Huang is better than Sheng Di Huang for treating women's disorders. When I first started practicing, I thought it was very odd that many male patients questioned my skills as I prescribed Si Wu Tang for them. They think that formula is only for women. Not really. There is no restricted formula for specific conditions or gender. Even Yuan Tang can be used for prostate disorders. But most patients will think that to be strange, since it's mostly used for leukorrhea. Who says Yuan Tang is only for patients with leukorrhea? It can also treat cough. Buffay Tang is a more specialized formula and originally mentioned in Yongli Qin Fang. It's a collection of precious formulas. It has Ren Shen, Huang Qi, Shu Di Huang, and what else? Wu Wei Zi, Ziwan, Sang Bai Pai. It tonifies the lung, benefits qi, arrests cough, and relieves dyspnea. Ren Shen, Wu Wei Zi, very much like Sheng Mai San, right? Huang Qi in this formula can be either Zi Huang Qi or Huang Qi. What you need to be careful with is the dosage of Huang Qi. If there is a lingering exterior pathogen, don't use a high dose. There is also Shu Di Huang and Wu Wei Zi. That's why you should be careful in patients with spleen deficiency or patients with loose stool. Shu Di Huang is hard to digest, especially for those who have severe spleen deficiency. This formula is excellent for lung deficiency leading to wheezing or dyspnea. So you may ask yourself, why not use Buffay Jiao Tang instead? Why not? What are the ingredients? Don't know? Ma Du Ling. There is Ma Du Ling in Buffay Jiao Tang. So, it's not available anymore due to the aristolochic acid incident in Taiwan. Do you know what happened? This TCM practitioner had 3 brothers who were MDs. This TCM doctor didn't have many patients, so he looked to sue the Herbal company for some money. He had a family history of dialysis. Once, at a nephrologist convention, he showed up and claimed that his kidneys were damaged by Chinese herbs. He said that he had to receive dialysis because he took Longdan Zhejiang Tang. I believe he saw the report from Belgium. That report from Belgium described the nephrotoxic Chinese herbs. He said that he was a victim of Chinese herbs. At this convention, they were very happy to hear that since MDs in Taiwan are always trying to find faults in TCM. Because of this, Ma Du Ling and everything else that had aristolochic acid was banned. Fang Ji and others were banned. Do you know how he took the herbs? The dialysis is not really from the herbs. He said he took Longdan Zhigan Tang, right? He said that he took Longdan Zhigan Tang as a tonic to protect his liver because he stays up late at night. What the? Did he even study in school? How can you take that formula as a tonic or as an anti-aging formula for preventative purposes? He did order Longdan Zhigan Tang from an herb supplier. Do you know how much he ordered? He bought 2 400-gram bottles in 5 years. This amount is probably less than the salt he took in those 5 years. How can that dose cause any damage? Impossible. It's just pure extortion. He didn't win the case and didn't get any money. As a result, he sought sympathy from the Western medicine community, and in the end, both communities despised him. He didn't study enough, and as a result, the whole profession has to suffer now. This is much like a female herbalist who goes around saying Si Wu Tang can cause fibroids to grow. I wish they would go home and not express their ridiculous opinions. Taiwan has had so many bad doctors like this, who are not ashamed of what they are expressing in public. This particular woman announced her opinion on Si Wu Tang, promoting fibroids on the radio. Along with many of my colleagues, we wanted her to prove it with patients in her clinic, or we wanted her to show research with data that proves this. Nothing. There is absolutely none. Yesterday, my topic was fibroids, right? Did you notice how much Dang Zhui and Chuan Zhong were used in the formulas to treat fibroids? Si Wu Tang sometimes is a must for treating fibroids. I wish you would stop spreading this false information. Si Wu Tang, when needed, must be used. Here comes Si Wu Tang. Do you know this formula? Biao Zhu Liu He Tang. This formula was originally found in this book, Yi Li Yuan Rong. So this Si Wu Tang is also called Yuan Rong Si Wu Tang. Yuan Rong Si Wu Tang. So instead of Biao Zhu Liu He Tang, you would hear the name Yuan Rong Si Wu Tang more often. What's added in there? Zhui Zi and Di Zhu Pai are added to address the yin deficiency heat rising from disharmony of yin and wei levels as a result of suffering from a chronic condition. The doses are high, so you can adjust it accordingly. It can harmonize blood, yin and wei levels, and release the exterior. You can see that the proportion of Si Wu Tang is stronger. Zhui Zi and Di Zhu Pai are lower in dosage. How do we use this formula? It's perfect for common cold during pregnancy or spontaneous sweating due to exterior deficiency. It's best for weak constitution with floating and weak pulse. So it's also very good for colds during menstruation. Usually people use Zhao Chai Hu Tang, but you can adapt this formula in your prescription to see better results. You would be amazed at how fast herbs can work. Do you have women patients with dysmenorrhea so severe that it is debilitating, or those that have spontaneous sweating during the period due to the pain? In conclusion, it's best for common cold with blood deficiency. For modification, you can add Du Zhong if there is a restless fetus. Also, Sang Ji Sheng and Zhu Duan are excellent too. Do you remember the taste and property of Du Zhong? Acrid, bitter, and warm. When the body is warm, what herb can stabilize the fetus? Huang Qin. Huang Qin is excellent to stabilize the fetus for mothers who are warm or hot. If the mom is deficient or cold, don't use it. Huang Qin and Bai Zhu combo is invented by Zhang Jing Yu. Nu Zhen Zi and Han Liang Cao can also be added. Why? Blood deficiency. You can look at the rest yourself. It's very self-explanatory. Okay, next, let me explain this chart. For common cold due to exterior deficiency, you need to figure out if there is any interior disharmony. For those that don't, then use Zhui Zi Tang with or without Gi Gen. There's no Ma Huang used here. What formula is Ji Gen Tang based on? Is it Ma Huang Tang with Ji Gen or Zhui Zi Tang with Ji Gen? It's Ma Huang Tang. It's Ma Huang Tang with Ji Gen. If there is exterior deficiency but no interior complication, do you use Ma Huang for its diaphoresis effect? No, right? That's why you would use Zhui Zi Tang Jia Ji Gen or Ji Zi Ho Po Jing Zi Tang. What if the patient has profuse sputum and wheezing? You need Hu Po to release the exterior and Jing Ren to relieve wheezing and to aid expectoration. If interior is cold, then use Ji Zi Tang. If there is heat inside, then use Zhui Zi Jia Shi Jiao Jing Ren Tang. Si Tang can have so many variations, or you can simply use Ma Jing Gan Shi Tang if there is exterior excess, if there is no interior complication. Okay, what's the difference between Ma Huang Tang and Si Tang? Is there perspiration? Yes? No perspiration? One has wheezing, one does not. Ma Huang Tang patients will have wheezing. Zhi Gen Tang patient doesn't have wheezing. What about this? Why don't you go back and study this chart very carefully, because I purposefully didn't clarify it that much for you here. Interior cold can be complicated with damp. So there is exterior pathogen with interior damp and water stagnation. What do you use? Zhao Qing Long Tang. What about Dao Qing Long Tang? Da Qing Long Tang patient has interior heat, so there is no Gan Zhang, Zhi Jin, and Wu Wei Zi. No Gang Zhang, Zhi Jin, and Wu Wei Zi. Instead, there is Shi Gao. These two blue dragons both have sputum that can't be expectorated. One is due to heat, one is due to water stagnation with cold. Both aim to expectorate the sputum, but in completely different ways. Da Qing Long Tang clears heat to expectorate sputum. Zhao Qing Long Tang warms the lung and expectorates sputum. Many people don't use Gan Zhang, Zhi Jin, and Wu Wei Zi in patients with sputum because they are afraid the condition might turn into heat. Zhao Qing Long Tang is very similar to Li Zong Tang. So, Da Qing Long Tang is similar to the effect of Bai Hu Tang. Bai Hu Ren Shen Tang, Ma Jing Shi Gan Tang. You have to use a formula with Shi Gao. What about internal cold? Use Lingan Wu Wei Jiang Jin Ban Jia Tang. Women who catch a cold during menstruation use Zhao Chai Hu Tang. You can add Yuan Rong Si Wu Tang for a better effect. Tonifying blood. Why? If the pathogen can directly invade the uterus, do you think the uterus is strong? No, that's why you need to enhance the function of the uterus. In Shao Yin syndrome, you need to use formulas like Zhu Fu Tang. Shao Yin syndrome essentially involves heart and kidney disharmony. Exterior and interior conditions with summer heat, diarrhea, vomiting, etc. are more complicated. There is a doctor in Taiwan who says this condition is called yin type of summer stroke. He says this happens when one walks into a cold air-conditioned room during a hot day. He says it's the result of a mixture of cold and heat summer stroke. I don't agree. I think it's just summer heat stroke with a cold. This happens a lot when the weather is hot, but not enough to produce perspiration, and the person walks into a cold, air-conditioned environment. The cold constricts the pores, causing it to be even more difficult to sweat. Then, heat is trapped inside, leading to a low-grade fever, around 38.5 to 39. Other symptoms include sore throat, dry throat, and the watery sputum which turns thick and sticky. This is summer heat with cold invasion.